Hey, Sarah.
Yes.
Good morning. Good afternoon,
Good
I
morning,
guess.
Amanda.
So I did not respond to your email saying that KSDE had any updates, but the state board approved the Navigating Next guidance about an hour
Wonderful.
ago. I can have that queued up to drop in the chat if you can turn it over to me for like 30 seconds.
That would be great. I would be happy to.
Perfect. Thank you.
Well, I have a little after 12 o'clock, so let this be your official welcome to the February 10th Strengthening Early Childhood in Kansas biweekly webinar. And we're going to run through some general updates very, very quickly because we have a really awesome conversation that we want to have with you. Before I do that, a couple of bits of housekeeping, and that is that this webinar, as all of our webinars are, is being recorded. We also will have the recording of this webinar and the slide deck up on the Children's Cabinet website shortly thereafter. This one might be a good one to bookmark because we are going to give some context about the Child Care Development Fund. And if you are going to help us gather feedback on that, this could be a good recording to send out to folks in your network so that they can get that context and understanding. And we will just dive right in to the specifics to make time for that conversation. So the first thing I wanted to, well, quickly our agenda, some general updates. I want to touch on the Kindergarten Readiness Year 2 subgrants, and then we'll turn it over to the discussion around CCDF. So Amanda, I'm going to go ahead and let you chime in with the Navigating Next and the good news from the State Board of Ed.
Absolutely. Good afternoon, everybody. So many of you, I'm sure, have been carefully and closely following along our Kansas State Board of Education meetings. They met yesterday and today to consider what we are calling Navigating Next, which is concise guidance to help schools as they consider how they're going to use additional federal funds to finish out this school year strong and have a strong summer and planning for the start of next school year. So I have dropped 3 things into the chat. The top link is the Navigating Next guidance, which was approved today. It's really short, so it is worth skimming. It does call out and highlight the importances of family engagement and supporting smooth transitions into kindergarten and first grade for our students who will be enrolling for the first time next year. Under that is Navigating Change, which you all might recall was guidance that was initially adopted last summer and that the state board has been periodically updating, particularly as there are changes in the consensus of our medical and health experts in terms of the best guidance for schools in their operations during the pandemic. So that guidance continues to be updated and it's right there. And then finally at the bottom is the Kansas Teaching and Leading Project, which is a useful resource particularly for our pre-K-12 schools as they are seeking to implement this guidance. It has a mix of online video modules and grab and go resources. If you are looking at this and you are somebody who provides professional development and technical assistance to school districts, or you would like to, feel welcome to reach out to me. I'll put my email in the chat and I can get you the link for you to be able to submit a proposal to add resources to that website, either online modules or grab and go resources. A shout out to Brenda Bandy from the Kansas Breastfeeding Coalition, who has already submitted some resources following our webinar 2 weeks ago. Thanks, Sarah.
You're welcome, Amanda. Thank you. Just a quick note here, we have talked a little bit about the new COVID-19 federal funding that has come down. Melissa Rooker from the Cabinet at the last biweekly webinar reminded us that this funding is coming through federal programs, so it isn't coming directly to states as to be used for states' discretion. It's really coming to those federal programs, one of which that we will be talking about today is the Child Care Development Fund. And the Department for Children and Families is the agency that administers that fund here in Kansas, and they are asking for public input on how to utilize that COVID-19 relief dollars. So we're going to have a conversation about public input for CCDF. This is something slightly different. This is really about the emergency funding that is coming to Kansas through CCDF for COVID-19 relief. That link is there, so we'd invite you to give some feedback on what you think about that relief funding. And the final update I have is letting folks know about the Kindergarten Readiness Subgrants. They are opened today. I believe they opened bright and early this morning. They are one-year grants with a $25,000 cap. The application closes on March 19th, and it's on through the Kansas Common App website portal. So if you're familiar with that, you can go to the cabinet website and learn a little bit more. And the purpose is really to support community-wide efforts to ensure successful transition of children into kindergarten from their early childhood setting, whatever that might be. And we really want to emphasize the community effort element of this. So while we think about kindergarten as being something directly related to school districts, and obviously they are critical partners in the work, we also know the importance of that warm handoff, of that transition, particularly this year, with kiddos who may have been in distance learning situations that, or just the trauma of COVID and how that might impact them as they transition into kindergarten, which is already a monumental event for our littles. So please think about that and what that means for your community and how you might be involved in that, and take a look at the RFP, and please submit your application if you are interested. Okay, so I'm going to dive right into the topic of the day, which is the Child Care and Development Fund. The Kansas Department for Children and Families is looking for your help in developing the CCDF plan for 2022 through 2024. So this is really an opportunity to help shape early childhood care, education, policy, services, and even some funding decisions. So to give you an overview of the CCDF planning process, we are having a series of public input sessions. We are also we have online now an electronic survey to address any or all sections of the plan. And I'll talk about a little bit what that plan is and why we have it here in just a moment, but I wanted to give you a sense. This is one input session. We will also have 2 other sessions available for the general public to participate in. And then we have some governance committee partners that have been gracious to allow us to use their meetings to have conversations too. So the Early Childhood Recommendations Panel, the State Interagency Coordinating Council, as well as the Workforce Advisory Development Group, we will also have CCDF discussions at their meetings in February. However, our conversations can only touch on elements of the plan, and so the entire plan and the entire ability to give feedback on the entire plan is online through that survey, as well as any targeted follow-up. So if you have a very specific issue you want to talk about, partners at DCF are certainly happy to have more one-on-one conversations. And then just for context, the plan is in drafting process. So this is a key element of drafting the process. And then we'll synthesize the input from the process through May and into June. And then in June, there will be a formal public hearing on the updated draft of the plan. And once that happens, people will get a chance to give a little bit more feedback on a draft that is a little bit closer to the finish line. And then the CCDF will have to submit the plan to our federal partners at the ACF in late June. So what is this aforementioned CCDF plan, if it's unfamiliar to you? It is a program that provides federal funding to assist low-income parents with childcare costs. It promotes learning and development. It also provides funding to enhance the quality of childcare for all children. So a lot of the childcare programs we have in Kansas are touched directly by the CCDF plan. So that is kind of the nature of the plan at a high level. And states are required, all states are required to submit a 3-year CCDF plan to the Administration for Children and Families, ACF, describing how they're going to meet federal requirements for their childcare policies and programs. So this is a 3-year plan, but I want to make very clear that it is an organic plan. So while we do have a deadline as a state to submit, we also are able to change the plan, amend the plan as needs change, as circumstances change. And so this is really the first step in getting feedback on the 3-year state plan. And then as we continue to have dialogue and engage with stakeholders, we can make little adjustments and tweaks to the plan as well. So they really are responsive to the changing needs of Kansans, which is great considering that so much has changed even in the last 18 months or so since we wrote our strategic plan. And You're here because DCF really wants to do this through partnerships and really build on the momentum of building the needs assessment and all the stakeholder engagement we did for the All In for Kansas Kids strategic plan. If you would like to view the draft plan, you can go to the website and pull it up, and you will notice very strong alignment with the All In for Kansas Kids strategic plan. So consider CCDF as a part of our overall system. It certainly is a huge element that supports a lot of the funding mechanisms and drives a lot of the decisions and the policies, but this is really about our broader childcare effort in Kansas, and DCF is helping facilitate and lead this work, but it's really going to have an impact on all of our state agencies and all of the work we do across early childhood. Just a minute, please. Just a minute, please. So I mentioned the website. This is a screenshot of the website. And so you'll be able to, you can see here that there is a little snippet of the public input sessions that are available for you to bookmark. There's also a link to view the current version of the draft CCDF plan. I will warn you, it is over 200 pages in length. So it's not a quick read, but a very, very important read if you have the time to dive into that. And then the highlighted link that starts with electronic form on the left side of the page will take you directly to the online survey where you can look at a way to give feedback on all 7 sections of the plan, which is really important because today we are going to be focusing on section 2, which is family engagement and consumer education. So again, we don't have time in the span of 50 minutes to dive into all 7 sections. And so we felt like this was a great topic for all of you, our webinar guests. But you have absolutely permission to give feedback on all 7 sections. And the way you do that is to visit the link and the website and click on the survey and tell us your thoughts. So I have not been monitoring chat at all, but it looks like everyone's got links going on in the chat. So I am going to now turn it over to our facilitators for this conversation. Janine Huron and Mary Basket are going to help facilitate a virtual, rich discussion about family engagement and consumer education. And before I turn it over, one housekeeping logistics, if you could please drop your name and your organization or your name and your role into the chat, that helps us communicate back with our federal partners exactly who is getting this direct opportunity to provide feedback in the public forum. So please do that if you're able throughout the next 45, 50 minutes. And Janine, I'm going to hand it over to you.
Thank you, Sarah. Good afternoon, everybody. I'm here today, as Sarah just said, to help facilitate this conversation on section 2. I'm here with Mary Basket, who will also be coordinating and facilitating with us. And let me just frame this up a little bit. We'll be talking about the 2 key stakeholder partners involved in this process. The families who are seeking access to the high quality child care services, particularly those low income who are eligible to access the CCDF funding, and the child care providers who are established and able to provide and receive payments for those services. And remembering that, as Sarah said, a lot is changing. We are watching needs rise. The economic strain that's being experienced in communities across Kansas are beginning to show, and some of the pandemic factors have shown a light or intensified our view of the inequities that are inherent in the child care system. So we're really looking to identify those things and think about what we might be able to do about it. So I also want to put you at ease a minute. This hopefully will be the best no pressure part of your day. We do not have to make decisions or synthesize themes or anything. Our number one goal today is to generate as much discussion and input as we can to identify the strengths related to reaching our 2 primary stakeholders, the families and the child care providers, as well as gaps we may have that we might want to fill or things that we may want to change. So technically, anybody can unmute yourself at any point in the conversation and begin to contribute. And we strongly encourage you to do that. You can also type an idea into that chat feature and or ask a question via the chat feature. And I think that Jenny and Sarah are monitoring that as we go too, so that you'll be able to interject in that way. So rather than begin with a prescribed question, I want to provide just an opportunity here for anybody who has general input to CCDF and the relationships, how we are engaging families and childcare providers, and just get to things that are on people's mind right off the bat. And then when we've accomplished that, we'll get started with some specific questions. So now is the time. If you have general input on this particular topic. Okay, so let's get started thinking this way a moment. In order to make informed choices for their families and for their childcare organizations, really people need connections and they need information. So let's start with that and let's explore the communications that support the connections and the information for our stakeholders. What do people depend on? Are you aware of how such information is exchanged at this point? What do you think?
Janine, right now, what we're doing in Lyon County is primarily using Zoom, and we're also, communicating through social media, and also just having monthly agendas where we have a planned conversation, that we have specific topics that we're addressing or questions that need to be addressed, just to kind of keep us all together on the same plate and just to kind of check in with each other as well.
Thank you. And is that, Jody, with your families, with colleagues in the field?
Good question. It's primarily with like our early childhood stakeholders within and around our community. And there's also resources that we're providing. So it's kind of it's an outreach, but it's also a way to communicate with each other. But primarily it's with like our early childhood stakeholders, our preschool educators, and our home providers.
Wonderful, thank you. Are there others that are finding other tools helpful?
Janine, this is Mary. We have several comments in the chat in response to that very question. One is by phone, a second by social media, then family recommendations and past experiences. And then someone added, what is lacking, I believe, is the face-to-face connections that are not happening due to the pandemic. So that seems like a start to a very rich conversation about how things are different, have been different, are different, and what that means for our family engagement.
Right.
Hi, this is Rachel Willis with KPERC, and I'll share that we have seen providers really using text messaging more and more with families, as it seems like they have to be much more flexible and adaptable to the various needs as far as working from home and coordinating schools and older children and that sort of thing. So we've really seen providers using maybe even different apps to do those group communications through a text message as a primary way to communicate with folks.
So by phone and text.
This is Peggy. I think just in terms of reaching people and helping them engage in the childcare development, CCDBG, either as a eligible family or as a provider, I think that the role of gatekeeper connections is really important. I know that the health departments typically talk with people who are interested in becoming new childcare providers about the childcare subsidy and what it takes to get involved. And so there's that connection. But also just the whole idea of applying for and becoming eligible and managing that benefit can be really daunting just because it's fairly complex. I mean, I think there's a certain amount of detail involved. There's a lot of misinformation as well as, as far as what receiving that really means. Also the current requirement, it's not an expectation for child support enforcement cooperation when there is an absent parent in the family structure is a real barrier. I believe last time I looked at that, I think that was a federal thing. I don't think that was, I think it's also in the HOPE Act, but I think it's a federal thing. But just having a trusted someone that can help a family understand all of that and figure out, how to navigate that and what's worth it in terms of a potential, I guess what could be felt as an invasion of privacy or a risk. So it takes those trusted partners to be able to help people make that decision, I think, often.
Yes.
And I know DCF works to make the process, as doable as possible, but there is a certain amount of eligibility process that does have to go on.
Right.
Janine, we have some additional comments on the chat. One is about a word of mouth network in a military community that is relied on, as well as Facebook groups. We've had several comments about using Facebook groups. And then we also have a comment in response to the question about new or evolving family needs. Families having to choose between free half-day preschool and paying for full-day childcare spots. And the question is there a forum to discuss partnerships between public school districts and childcare facilities? Perhaps other resources that can help support families through this choice. So that's a question we might throw out to the group. Are there ways that school districts and childcare facilities can have that connection?
That's one of the questions that we were really concerned about or really thinking about, that reliability of the support networks, who's in that network. And we've identified multiple of the connectors, the health departments, the school districts, et cetera. And then are the support strategies or the way that they are able to reach families reliable, and consistent? What are you seeing in that way? Maybe let me phrase that another way. There's a lot of important information to know. And as Peggy mentioned, this can be complex and it can be a little daunting for people. What do they need to know? And what are the, there are so many paths, as you've identified, to getting that information. What are the most reliable? What are the most frequented, I guess, methods that people are using?
I guess what I see often is early childhood special education services, kind of talking with families about their child's development and which option would best serve their needs.
Mm-hmm.
But that puts families in a position where they have to make a decision between financial resources and support services. So I think that's difficult.
Yes.
Hi, this is Crystal with the Family Conservancy. Our program focuses in Wyandotte County and making childcare accessible. And we actually have advocates employed to assist families in applying for specifically the childcare subsidy. And a lot of the barriers that we're finding is having so much dependent on like a physical address. You know, we find so many times families aren't receiving, or there's a disconnect between getting the renewal paperwork, and so then they're kind of thrown into a period where they're disqualified. So just having that paperwork be so dependent on their address. We have a lot of transient families who are moving often, and so that's been a big barrier. And I had something else in mind that just escaped me. So that was the main thing that I wanted to address.
Yes, thank you.
This is Peggy again. One thing that I would definitely want to highlight as a positive is the moves DCF has made over the past, I think the past year. I lose track of time these days. But in maximizing the reimbursement rate for providers, they've increased dramatically the percent that providers are able to be paid now based on the market rate.
Kudos on that, right? More is better there. Going back a minute to the relationships and the myriad of relationships, and the transients that has been articulated here. How are we well suited to maintain the strength of these relationships and these connections over time? So through all of those transitions, what are some of the supports that are consistent over time? Or other trends that we're seeing that are affecting people in addition to frequent moves or the difficulty getting through the material? Okay, let's think a minute about the providers. I was hearing that that their information is complex as well. What resources do they know where to go to get additional information? Accessibility is what we're looking for here. That's a goal.
Janine, this is Jenny. While folks are thinking about accessibility and where to go to get information, I want to call out a few comments in the chat. We have
Good.
one from Gail that mentions that some of the families, for some families, they were just reiterating that some of that paperwork to maintain, if they get, assuming they get the paperwork and have an address, that paperwork can be overwhelming for subsidy, which can sometimes lend to choosing half day free versus full day. I think there was another comment earlier about that as well. And then another comment about time being an issue for providers. Many providers, specifically in home, our in-home providers are hands-on, and there's just not the network for referrals. So kind of the family's perspective and then also a provider perspective.
And Janine, we had a comment earlier about people being so willing to share how they are connecting with families during these times. There's some very innovative strategies happening in our communities. So I wanted to acknowledge that comment and maybe then raise the question of what is going well in terms of this whole area of family engagement and consumer education. What are some bright spots or some examples that you would point to as, boy, this is working? Maybe we can build on this, amplify it.
Mary, I was just thinking kind of along those lines too. I think a real bright spot that we need to be sure and mention and leverage looking at the going forward is the links to quality, having completed their pilot now and getting ready to, to ramp up into a bigger availability, I think, in terms of support for providers and knowing how to navigate the system and knowing what's available, as well as the ongoing, how do you make this work as a childcare business owner, and how do you reach parents and families is a real strength for our state.
Excellent.
Back to the previous question on the provider issues. Sorry, I have my mask on. I think one of the things that we've struggled with is specifically with DCF of not having an exact person that we can talk to. And so having to call into that 800 number, and our parents are having that same issue and then being on hold forever. And so being able to identify who our regional people specifically are that we can make direct calls to them and who exactly we can refer parents to would be very helpful, because I have had some parents that applied for DCF and then they just said, I couldn't, it was taking half of my day waiting on hold. I couldn't be on anymore. And so getting those direct contacts at DCF.
Thank you.
And then we have a comment about the KDHE website is great, but there's so many places that we have to go for information. It would be nice if everything was in one place. The suggestion being additional tabs on the KDHE website for the other organizations we have to work with. So I'm not sure if that's coming from a provider or a family, but what do you all think?
I see a couple, yes, agreeing with direct contact information, that ease of connecting the dots among the various players. Just understanding the system can be daunting, and then going into the system to begin to access it for your family can be daunting. Are there navigators? Are there, who are the natural navigators that people are using now?
Hey, this is Angela from Saline County, and I'd just like to share right now, we are working on really amping up our salinaparents.org website, and we are really trying to make that be a one-stop shop for childcare providers and families in our community. So if we get a new family that comes in, they'll know, hey, I got to go to salinaparents.org. And on there, we'll have like parenting resources, tips, kindergarten readiness information, social emotional health. So we'll have all of this on there. And so whatever they're looking for, we're going to put links on there that says, okay, I need this. And then they can click on that and then go to that, and then they'll know where to go in our community.
Right. When they do that, are you seeing, what in particular are you seeing that is a high volume need for information? Is there a pattern to some of that? Whoops, there goes Angela. She can't get in.
Janine, I think one thing is one provider said it would be great to make families more aware of childcare subsidies. Many times they've never heard of subsidies. And then kind of a second to the idea of having everything in one location for an in-home provider. So, and Angela said, sorry, my camera.
Yeah, I just see that. Gotta love the technology. Oh my goodness.
And a comment about immigrant families are often left out of the loop because some or all family members don't qualify for public benefits. And related to benefits from the same person was the idea of a whole household budget approach to financial assistance, not separate pots for housing, for childcare, for food, for transportation. So lots of great ideas.
Yes, there really are a lot of great ideas. We've kind of popcorned from one idea to the next, and that is helpful brainstorm. I'm looking here to be sure. With regard to accessibility, we're always looking for, of course, those language barriers, of course, the those who may not have ready access to technologies. How are we doing in those camps? Are we able to reach people in the ways and in the language that they are comfortable?
Mobile is extremely important.
It is very important. Is this a bright spot for us? Is this something that we've got going?
I think it's both. I think it's great because parents do tend to have access on mobile. However, it also is a challenge because if that's their primary access, it's for everything.
Yeah. Yeah.
It's a challenge to make sure that everything we're doing and building is accessible that way. But it also, we need further broadband and other accessibility to really have it be robust.
Right. It's a convenience, yes, to have so much available to people online, but if you're accessing that on your phone and trying to fill out forms from your phone, sometimes those interfaces are more difficult. Okay, and I'm seeing the comment and the reminder that in the rural areas, there's often not internet service. So speak to that, because we have an awful lot of rural area here. What is compensating in those areas right now? What do we wish we had?
I know we have some families that will have to drive 20 miles and then sit in their car outside of a hotspot provider, whether it's the sheriff's department or sometimes the library. We have one small restaurant that offers it. But that can be pretty daunting when you need to complete a form and you have to have your children with you, and it's 2 degrees.
Yes, that's right. The pileup of difficulties.
We have a few more comments, Janine, about resources and getting information out, in this case to providers. Just giving providers links to resources doesn't mean they know how to navigate getting to them to get what they want or need. And then another comment about any information on the website should have Spanish translations. I believe only the applications are in Spanish, but not the eligibility information on the online pages. So something else to—
Good suggestion.
Yeah.
Yes. Have we touched on provider access enough? Do providers know, okay, I'd like to accept subsidies, and how do I do that? What's required of my program, and how do I get in the loop? Where's our provider community? What do they think? What do they think about that?
Well, that
If
generated
they're-
a couple of quick comments.
Okay.
The lack of a good mentoring program for new in-home providers. There's an orientation, but it just scratches the surface. And I'm seeing some heads nodding on that one.
Yes.
Leavenworth County has published a brochure of early learning programs in the county that are public programs, distributed all kinds of different locations, but the childcare providers are not in this brochure. So.
Right. And one of the key things that the federal government, along with our own plan, are really focusing on is this empowerment of families to make choices for the partners that they would like with their family, right? So in order to do that, it requires you to understand the breadth of what's available out there. What is the best fit for your families? So good points about how we, who is included in the information that's available, the connections that people need.
This is Lindsay from Cali County. I think just the idea, I mean, we talk about choices, but a lot of rural areas and the stats I've seen from All In from Kansas Kid they're just not choices. They're very little, 0 to 3 in particular. And we have drastically declining rates of in-home childcare providers. And in our area, lots of resources for in-home providers, but not as many wanting to go into that. And so you can do all the right things, but if you don't have choices, that's an issue as well.
Yes. Thank you for that perspective. I do know that there are some innovative things happening to try to think about how do we develop resources where there aren't. And would anybody want to speak to that? How do we help support that network so that it's there for people to choose, is what you're saying, Lindsay, right? It's like, yeah. The community part. Someone was getting ready to talk. Please talk. I see the suggestion about launching a survey and asking providers what they need. This would be this and some of the meetings that Sarah was talking about, the surveys that we were, have online. All of those are ways to reach providers, and the weekly webinars, the weekly newsletter, all of that we can continue to help people to know what's available. Yes.
Janine, I would just put a plug for the child care experience mapping project that we're doing. There'll be a link in the weekly emails that's coming out that's going to ask basically providers, what is your experience? What are the bright spots? What are the challenges specifically for child care providers? So that is coming soon. So look for that survey in the weekly emails to come.
Great plug, great opportunities.
I wonder if we want to put the questions back up again.
Yeah.
Just to kind of see where we are with those and see if those perhaps spark some additional thoughts. We do have a lot on the chat. We're not going to read everything, but we're certainly getting great input. Thank you all so much.
That's right.
We've talked a lot about barriers and challenges. I'm curious what you all think about the fourth question. What is no longer needed? Sometimes we keep adding new things that are good, but we don't necessarily get rid of things that aren't working anymore. Are there things that you can think of related to our topic area that are no longer needed? We don't ask that question very often, so
No.
I give it a little thought.
I will say I was really pleased to see the switch of covering full day and and part day versus the hours. So that was a step in the right direction, in my opinion. So hopefully we can hold on to that. So it's not answering that question directly. And I was going to say, kind of going back to provider disconnect. So something that I'm hoping that maybe we can bring back, and forgive me if I'm not familiar with the current process, but we've heard from a lot of our providers that it's very difficult when they don't see the family plan that identifies the amount that each child is awarded for the subsidy. There's a disconnect about what parents may put towards their care versus how much they're awarded. And so, I do like the way that it's designed to empower parents and to, allow them to make those disbursements. However, a lot of times they're awarded more for a child, and the centers aren't quite seeing that full amount that children are awarded. So if we could maybe bring back where the providers see the family plan, then that helps them, maybe it just helps them receive the amounts that they're, I guess, entitled to.
All right. So we always have to evaluate, right? When we make changes, what do we need to carry forward and what do we need to let go of? So that's helpful. Thank you. Anything else that comes to mind on what's no longer needed?
I'd like to back up really to that first question. And we know specific to our health and safety, what family needs and priorities are changing. But are there other ways that family systems are changing that we need to think about as we're creating systems to support them? That might be related to work hours. That might be, again, geographically specific changes out there in the communities. Okay, and I'm seeing a note here from Peggy about the family planning, and remembering too that sometimes there's maybe more than one provider, a weekend provider and a weekday provider, and how do we, include providers in that and keep the family in charge, right? Over the course of 3 years, back to what Sarah was saying, this is a 3-year plan. Ideas for how you would, what you would do that we can accomplish in a 3-year plan. How would we know that we're making progress in some of these barriers? That's a big picture question.
Here's an idea, a site where we could go for qualified subs within our area.
There you go.
And would love to hear community ideas with effort to support connections and family engagement. So maybe more local ideas. I'm assuming that's what that means. Correct me if that's not correct, not right. Mm-hmm. And then again, this has come up a couple times before, some shared services models. Any more thoughts about what that could look like? It's come up several times in the chat, and certainly I've heard it other places. Anybody want to speak to an example, perhaps, of a shared service model? Accounting, billing, enrollment, ways to share costs, perhaps, of some of those kinds of services.
Mary, this is Chelsea Schulte. I don't have an example. I don't know of any that are currently in action. But one of the things I see as a benefit to a shared service model is if you have a network of providers that already has a an agreement in place that they are a network that's sharing services. Things like a pandemic, when there become issues where we can't get paper towels, we can't get enough gallons of milk from the grocery store, to have somebody as a representative of that shared service network to be going out to those different resources and setting up the agreements. I think about how many family childcare providers were just in a rough spot. And they were all bargaining with their grocery stores to say, but I actually need more milk than this. If we could have had one representative speak on behalf of networks of family childcare providers, just the time and effort that went into solving problems like that could be resolved a lot faster.
Mm-hmm.
So an example of a good change, a possible change that would have particular additional benefit in times like we're in right now.
Right. Strength in numbers.
So we've got about 10 minutes. We want to save a little time at the end to circle back to Sarah and remind you of other ways to provide input. Let's see, what else? What other comments do we want to capture?
There was a trend noted in the chat a moment here that I saw about more families that are cohabitating, and that is being driven by some of the financial concerns that we're seeing. What benefits or challenges does that create for our families with regard to engaging with resources like this? Somebody speak to that.
Sometimes it depends on how they define the household or the family. And sometimes because of that, it can disqualify them from services because there's more income coming into the house because there's two people earning income, but yet they're still functioning. That particular family's income is still the same. Does that make sense?
I think I'm understanding what you're saying is that these families are coming together under one roof, but they're really still two distinct families, but for purposes of accessing some of the resources, they get considered as one. Is that what you're saying?
Well, and I think some of it is just the family's not sure how to fill it out because it asks for number of people in the household or something like that. And they're filling it out for everybody and not just for their individual family unit. And they're not clear on that specification that it's really that family's.
Okay, so how to even just classify yourself within the form so that it can be considered properly. Related to that, I'm seeing this comment from Rich on the gig economy and how there's different methods of gaining income these days, and how is that the same implication in terms of how eligibility is reported and determined?
And another question, Janine, about data on families that have decided to opt out of the childcare market in favor of family, friend, and neighbor care. Do we know how many, at what ages, and why? And I'm guessing that this last year has made that data even more important to take a look at. Mm-hmm. We hear a lot of anecdotal evidence, but really looking for some data there.
Yeah. This is quite rich input, really. You all, thank you very much for bringing so many ideas to the table, and it's such a broad conversation. And you've really done a great job of contributing in a way that helps us to see the scope and to make those considerations within the plan.
I would echo that, Janine. This has been amazing. This is our first session at all, the first public input session, but our first input session on the plan. So thank you for helping us feel that, boy, this is this is a rich process.
That's right.
With a lot to work from. So I think with that, we're going to turn it back to Sarah to kind of go over what else you can do to add other input and to help us get the word out. So Sarah, take it away.
Wow, thank you, Mary. Thank you, Janine. Hour. We really appreciate everyone's time. So I'm going to bring back up the slide that shows you what is on the website. So 2 asks, if you would, visit the website, share the link with your listservs, with your partners. You know, I know the plan is very large, and the survey has lots of opportunities for you to share both specific feedback or just general feedback. The survey also is divided by the sections. You can share as little or as much as you want. You can answer one question, or you can answer all of the questions. You can just leave general comments or very specific. So it's really your opportunity to do just what you did today with us. Raise your questions, raise your comments, raise your ideas, raise your concerns or your challenges, so we can understand that information, both for writing the CCDF state plan right now, but also in evolving and iterating it over the next 3 years, and then also with a lot of the other childcare programs, services, and policies that are that make up our system. So share the link with others who also would have thoughts to provide. I want to put a plug for 2 sessions that are public. It's on Wednesday, February 24th, and Saturday, February 27th. So there'll be an evening session on the 24th at 7 p.m. and then a morning session that Saturday at 10 a.m. And we did that because we recognize that many of our providers, especially our home-based providers, are not able to make times during the typical workday. So we hope that families attend, and we hope that our childcare providers attend. So please get the word out and send them to this page, and they can register to participate. Thank you guys so much. All of this input is being captured, curated, and sent back to folks who can make decisions and make difference. So thank you guys so much. I'm gonna just call out Nichelle Adams. We at DCF are very thankful for all of this input, and we agree with many things you are saying, and many barriers identified are ones we are already working towards making improvements on. So kudos to our DCF partners for opening this forum. And thank you guys again for your time today, and have a great rest of your Wednesday. And we hope we see you at an upcoming session. Take care.